So this is my third attempt at making this video. Hey YouTube, haven't done a video in a while, TillyJS. So I'm going to do a TMI moment video. I've been on TRT since roughly after Christmas, I think like January 1st, 2018. So no, I'm sorry, it'd be February. Because I've been on it about 4 months, 3 months, somewhere around there. I don't know, whatever. So I've been trying to do this video and I've been going into too much detail, so I'm gonna cut out the bullshit and just go straight to the thing. So 3 years ago, feeling very apathetic. Doctors diagnosed me as depressed. I'm like, I'm not depressed. I don't feel anything. I don't enjoy anything. I have no sex drive. I have ED, which I don't know is due to the psychological component, like I just don't want to have sex, or if it's a physiological component, like there's something wrong with me. Don't know. They were like, oh, no, you're probably just depressed. Here's some pills. But they tested me for testosterone, or they tested my testosterone, and it was 383. So the bottom end of the range of the lab work was 350 to 1,050 in whatever units it's measured in. And of course, in healthcare, as I work, I work in healthcare, they see a range. You're in the range, so it's normal. Well, anyway, so fast forward, I'm in Columbus, Ohio, still the same symptoms 2 years later. Except now my blood pressure is 140 over 100. I'm working out. I'm playing basketball with 17-year-olds. There's no reason for my blood pressure to be that high. Diet hasn't changed. Of course, my diet's kind of crap anyway. But anyway, I get it tested again this past November. Testosterone was 269, I think, but their range was 250 to 850 again. Oh, so it's in the range, so you're fine. Talked to an endocrinologist in Columbus, Ohio, at a hospital I'm working at, and she's like, no, you're not fine. You need to go to a testosterone clinic, one that actually treats you and measures your stuff. You've got an issue. Your testosterone should be in the 500s, at least. So I do that. I go to, I think it's TRT Center in Dublin, Ohio. That's where it started. Got tested again. Testosterone was 208. And they were like, for insurance purposes, we have to get 2 of those. So come back again in the morning, and I got it tested again. It was like 227. Woo! And I'm still way out of whack. Medically treatable is 350. So I was almost medically treatable 2 years ago. But anybody that treats just general practitioners, they don't read up on this stuff. They graduate and then they're like, okay, we don't do testosterone, so whatever. You're depressed. So I've been on testosterone for almost 3 months, so I'm just going to go over some of the things that have happened to me. Oh, the other thing is, so I've worked healthcare for over 10 years, and within the past couple years, after I do a 12-hour shift, no matter how hard I work, no matter how many patients I treat, whatever, after one day, I was debilitated. Whether it was a hard day, easy day, I could have sat on my ass for 12 hours. Did not matter. I felt like crap. 1 day, 2 days, 3 days, didn't matter how many I worked. And then, of course, the blood pressure issue, my blood pressure was 140 over 100, got put on blood pressure medication. So anyway, so fast forward, so now I'm taking testosterone shots. The thing that happened to me initially, I felt an ache in my testicles, which they said, well, that shouldn't happen. I was like, well, I don't know what to tell you. It is happening. It was just a minor nuisance, wasn't anything, whatever. So I would assume that my testicles are atrophying due to the testosterone. Don't know. The other thing is, within 1 or 2 days, again, you don't know what's placebo and what's actual physiological effect, which placebo can have physiological effect. But anyway, I can feel a difference. I can feel my energy level going up. The funny thing is, now I suffer from panic attacks. So the first 2 shots, I couldn't sleep for the first 2 weeks. I took the second shot. They advised me to take it early since I worked 12-hour shifts and I couldn't get in 7 days later because they want you. At first, I was on 140 milligram testosterone cypionate. Now I'm on 165. I think it was like 8 weeks later. But at this time, 140 milligrams. And I could not go to sleep. I would lay down and my heart was just beating through my chest. I don't know if my blood pressure was high. I checked it a couple times, but at that time, not really. But anyway, I had energy out the ass. So the second week, I decided to get a day early because they're like, you don't want to do this late. Bad things could happen. So I got it a day early. I had and I'm not exaggerating by much, if at all, somewhere between a 16 to a 24-hour panic attack, and I didn't realize it was happening at the time. My feet were sweating, I was sweating, I was like, what the fuck is going on? So I worked the next 2 days, 12-hour shifts, and this I'm not exaggerating on. I slept 4 total hours over 2 days, and I had infinite amounts of energy. At no point during that time was I tired at all. Now, I will tell you, those effects and not being able to sleep, that actually went away. But I called a buddy and told him about my heart beating through my chest. He was like, look, man, just go do some lunges, do some push-ups. It's the only way you're going to get through this. It's the testosterone. You're having a testosterone flare or whatever. You're just getting used to it. You have to work out. And he wasn't lying, because I walked around my RV park like 15 times at like midnight, 1 o'clock. By 2 o'clock, I'm like, I can't go to sleep. Like, there's no way I'm going to be able to go to work. But I think I went to sleep around 3, woke up at 5, and I was like, I don't feel tired at all. Anyway, sorry, I'm going to try to keep the story short. So after week 2, I experimented, stopped taking blood pressure medicine. Of course, I was getting my blood pressure checked every time I went into the testosterone replacement center, and my blood pressure was coming down every time I was getting checked. So this last one, so I'm on month 3, 4, somewhere around there. My last blood pressure was 110/68. So testosterone has fixed my blood pressure issues. Let's see, what else can I talk about? 12-hour shifts. I no longer have joint pain, which would make sense, because if testosterone is converted to estrogen, and estrogen helps with joints and bone health, then that makes sense that it would help with, hip pain, knee pain, shin pain. Because I have more testosterone is converted to estrogen, does have more estrogen, which means I don't have as much joint pain. Makes sense. I don't know if that's true. Didn't ask the doctor. Just kind of inferred that from my own research. So fixed blood pressure, fixed joint issues. Sex drive's through the roof now. I shouldn't say that. So me and my girlfriend went on vacation, and we fucked somewhere in 2 weeks' time, 14 days. We fucked somewhere around 18 to 30 times. But we don't see each other every day, so it's hard to really, put a value on that, I guess. But anyway, so the sexual desire's there. I actually enjoy stuff. Ride my motorcycle, work out, being around people. I enjoy everything. I'm not as moody, which, again, if you look up testosterone, it makes you aggressive, but it also says that it could make you moody. Didn't really do that. It fixed my mood, if anything else. I'm in much better mood. I don't feel as bad. What's the moral of this video? This long diatribe. I don't know. If you have any questions, feel free to ask me. Like I said, I'm on month 4, ish, a little more, a little less, somewhere in there. That's it, man. If you guys are having any issues, whether sexual, energy, pain, whatever, just get your testosterone checked just to see. And if you're under 50 and your testosterone is like under 400, I would go ahead and get treatment anyway. My personal preference. I wished I would have done this a couple years ago. I would have felt much better. So that's it. Diatribe over. Good talk. Peace. I'm sure my girlfriend will send me a message after she sees this video, and she's like, "Don't talk about our sex life." So, sorry, not sorry. Peace out, YouTube.